Those aren't my numbers. They are the savings determined by the Congressional Budget Office, which is the nonpartisan independent referee of Congress for what things cost. So that's our proposal. Insurance reform, making sure that you can have choices in the marketplace for health insurance and making it affordable for people, and reducing costs. Now, I think how many people would like a proposal that holds insurance companies more accountable? How many people would like to give Americans the same insurance choices that members of Congress get? And how many would like a proposal that brings down costs for everyone? That's our proposal, and it is paid for, and it's a proposal whose time has come. So the United States Congress owes the American people a final up or down vote on health care. It's time to make a decision. The time for talk is over. We need to see where people stand. And we need all of you to help us win that vote. So I need you to knock on doors, talk to your neighbors, pick up the phone. When you hear an argument by the water cooler and somebody's saying this or that about you, say, no, hold on a second. We need you to make your voices heard all the way in Washington, D.C. They need to hear your voices, because right now the Washington echo chamber is in full throttle. It is as deafening as it's ever been. And as we come to that final vote, that echo chamber is telling members of Congress, well, think about the politics. Instead of thinking about doing the right thing, that's what Mitch McConnell said this weekend. His main argument was, well, this is going to be really bad for Democrats politically. Now, first of all, I generally wouldn't take advice about what's good for Democrats. But setting aside that, that's not the issue here. The issue here is not the politics of it. But that's what members of Congress are hearing right now on the cable shows and in the sort of the gossip, columns in Washington. It's telling Congress comprehensive reforms failed before. Remember what happened to Clinton? It may just be too politically hard. Yes, it's hard. It is hard. That's because health care is complicated. Health care is a hard issue. It's easily misrepresented. It's easily misunderstood. So it's hard for some members of Congress to make this vote. There's no doubt about that. But you know what else is hard? What Leslie and her family are going through, that's hard. The possibility that Natoma Canfield might lose her house because she's about to lose her health insurance, that's hard. Laura Klinska up in Green Bay having to worry about her cancer and her debt at the same time. Trying to explain that to her kids, that's hard. What's hard is what millions of families and small businesses are going through because we allow the insurance industry to run wild in this country. So let me remind everybody, those of us in public office were not sent to Washington to do what's easy. We weren't sent there because of the big fancy title. We weren't sent there because of a big fancy office. We weren't sent there just so everybody can say how wonderful we are. We were sent there to do what was hard. We were sent there to take on the tough issues. We were sent there to solve the big challenges. And that's why we're there. And at this moment, we are being called upon to fulfill our duty to the citizens of this nation and to future generations. So I'll be honest with you. I don't know how passing health care will play politically, but I do know that it's the right thing to do. It's right for our families. It's right for our businesses. It's right for the United States of America. And if you share that belief, I want you to stand with me and fight with me. And I ask you to help us get us over the finish line these next 2 weeks. The need is great. The opportunity's here. Let's seize reform. It's within our grasp. Thank you very much, everybody. God bless.